This is a video journal of my open reduction internal fixation surgery on my left ankle that scheduled to take place November 29th, 2016. My name is A.T. Stewart. Just to give you a little history, this is the x-ray that was taken when my ankle was broken. It was on November the 15th. It was a motorcycle accident. I was making a U-turn and the bike began to roll to the left, and I put my left foot down to try to stop the bike, and as a result dislocated my left ankle and broke several bones. As you will see, this is x-ray on the left of the dislocation and the fracture as it appeared in the emergency room within an hour of the accident. And on the right you will see the splint after it has been reduced and a cast has been put on it, or the cast is about to be put on it in the emergency room. Now this happened on a Tuesday, and on Thursday I went to see the doctor, the orthopedic surgeon, on November the 17th, Dr. Richard McGuire, and they did an x-ray in his office, and as you can see, the fracture reappeared. The cast did not hold it, and it reappeared. They did not accomplish fixation with the cast, and therefore open reduction internal fixation surgery was recommended by Dr. McGuire, and that will take place on November 29th. It will be 2 weeks after the injury. He said he liked to wait 10 days to let the swelling go down, and since the 10th day was Thanksgiving, his next surgery day was on Tuesday the 29th, which will be 2 weeks after the injury. I plan to keep a video journal of my progress, and the purpose of this is to help someone else who may be anticipating going through a similar surgery, that you can at least have somebody else's experience to maybe help you to look at your experience and to gauge your experience. Obviously everybody's experience is different, but nevertheless this hopefully will at least give you somebody's experience that you can use to gauge your own experience. I'll be back with you when the surgery is about to take place. Here's a picture of the cast that they put on in the emergency room. It's not a typical plaster cast that I used to have when I was younger, but it does have the splints on both sides and on the bottom, but it's nothing in the middle here, I guess because it can allow for swelling, and it's just ace bandages that they wrapped around the splints on the side. As you can see, it's getting a little ragged looking now. Now I put this little booty over my toes just to kind of keep them warm, and I just took a sock and cut the end of it. Now, as you can maybe see, I just cannot stand my toes to be covered up, and so I kind of work on the cast till my toes can be exposed and wiggle. I'm going to ask them to make sure they don't cover up my toes after the surgery. And if they do, I'm pretty sure I will whittle around on it to get them exposed again. Just, one of those things some things you just can't stand. I've had hand surgery several times, and they wrap up my hand, and I just got to have space between my fingers. I cannot stand for them to just be mashed together, and so I hope that won't be a problem. But here's the cast. I keep it elevated most of the time. So that's it for now. I'm back with a few more words that I might be encouragement. There are a couple of items that I purchased that have really helped me. The first one is this Seal Tight Freedom Cast. It is a heavy plastic that you can actually put over your cast, and as you will see, it fits there on your leg. And it was very helpful and has been helpful, enabling me to take a shower without getting the cast wet. And so if you're tired of taking a sponge bath and you would like to really take a shower, I would encourage you to get this Seal Tight Freedom Cast and bandage protector. It really worked for me. Also, you might want to consider getting this knee walker because, again, it's just walking on crutches gets to be difficult at its best. And so this I found as I did my research, out of 1,972 customer reviews, it got almost 5 stars. And as I read about it, it has worked for me. Again, this is from Amazon, and I would encourage you to consider getting this if you're having an ankle surgery. Getting this knee walker, it sure beats crutches when you're going to walk any distance at all. Now you do need to be careful. It can tip over, and you need to get used to it and follow the instructions. It wasn't that difficult to put together. It does fold up so that you can put it in your car, and then you can go places, and again, it makes it so much more comfortable. All right, that's just a couple of things that I wanted to point out, and talk to you again later.